It was a rainy day in March when 8-month-old Camille began crying softly each time she tried to crawl. At first, her parents thought it was something small, maybe growing pains, maybe a stomach bug, but soon she stopped eating, she vomited after her meals, and then she cried every time she tried to move her tiny legs. Doctors suspected all kinds of things: food intolerance, a virus, maybe even an infection. But after several visits, and after watching their baby girl grow weaker, her parents insisted on deeper tests. At Children's Hospital New Orleans, the truth was revealed. Camille, not yet even 1 year old, had acute myeloid leukemia, a dangerous form of blood cancer. Her parents were devastated. How could a baby have cancer? What did this mean for her life? Yet after months of chemotherapy, endless nights in the hospital, terrifying risks of infection, and round-the-clock care, Camille went into remission. Today, she is a thriving teenager. She goes to school, she plays with friends, she even plays sports. Camille is living proof that blood cancer is not always the end of the story. It can be the start of survival. Camille's journey highlights why we are here today. September is National Blood Cancer Awareness Month. Blood cancers, also called hematologic cancers, affect the bone marrow, the lymphatic system, and the blood itself. Unlike solid tumors such as breast cancer or lung cancer, blood cancers disrupt the very system that produces and circulates the cells that keep us alive. Every year, over 1.5 million people worldwide are diagnosed with blood cancers. In the United States alone, more than 180,000 new cases are identified annually. The good news is that survival rates have been steadily improving thanks to advances in chemotherapy, targeted drugs, stem cell transplants, and newer immunotherapies. But awareness, knowing the symptoms, recognizing risk factors, supporting research remains crucial. What exactly is blood cancer? To understand this disease, let's break it down simply. Your blood is made in the bone marrow, the spongy center of your bones. Here, stem cells transform into red blood cells that carry oxygen, white blood cells that fight infection, and platelets that help your blood clot. In blood cancer, this system malfunctions. A mutation in DNA tells certain blood-forming cells to multiply out of control. These abnormal cells don't mature properly, they don't die when they should, and they crowd out the healthy cells. There are three main families of blood cancers: leukemia, cancers of the bone marrow and blood. There are acute forms which progress quickly and chronic forms which develop more slowly. Lymphoma, cancers of the lymphatic system, which includes lymph nodes, spleen, thymus, and other organs that fight infection. Hodgkin's and non-Hodgkin's lymphoma are the most common. Myeloma, cancer of plasma cells, a type of white blood cell that produces antibodies. Myeloma, cancer of plasma cells, a type of white blood cell that produces antibodies. Each type affects the body differently, but they share one devastating trait: they weaken your body's ability to fight infection, carry oxygen, and clot blood. Symptoms to watch: blood cancers can be tricky because their early symptoms mimic common illnesses. People often mistake them for the flu, stress, or aging. Key warning signs include persistent fatigue and weakness, unexplained bruising or bleeding, frequent infections or fevers that don't go away, night sweats and chills, swollen lymph nodes, especially in the neck or armpits, unintended weight loss or loss of appetite, bone pain or tenderness. Knowing these symptoms and acting early can literally save lives. Survivor stories: Tasha's story. Take Tasha, a group home manager in her 30s. One morning, she noticed a large bruise on her thigh, even though she hadn't injured herself. Then came fatigue and constant infections. Blood tests revealed she had acute lymphoblastic leukemia. Treatment was long and brutal: rounds of chemotherapy, hospital stays, hair loss, nausea. But after a stem cell transplant and months of recovery, Tasha emerged in remission. Today, she shares her journey to encourage others. Cancer broke me down, but it also rebuilt me into someone stronger. Jeff's story. Or consider Jeff. He was in his late 50s when routine blood work showed abnormal counts. He felt fine, but further testing revealed chronic lymphocytic leukemia, a slow-growing cancer. At first, doctors watched and waited, since his disease was not aggressive. Eventually, his condition worsened and required treatment. After therapy, Jeff reached remission, celebrating 10 years cancer-free. He often says, don't ignore your checkups. Sometimes your body whispers before it screams. Causes and risk factors. So what causes blood cancer? There's no single answer, but we know some important risk factors, causes and risk factors. Genetics, certain inherited syndromes or mutations increase risk. Age, many types are more common in older adults, though some strike children. Chemical exposure, long-term contact with chemicals like benzene raises risk. Radiation. High doses of radiation, whether from accidents or certain medical treatments, can play a role. Lifestyle. Smoking significantly increases the risk of some leukemias. Immune deficiency. People with weakened immune systems, whether from HIV, medications, or transplants, face higher risk. It's important to note, most patients did nothing wrong. Blood cancer isn't contagious, and it isn't caused by stress or diet alone, but avoiding smoking, limiting toxic exposures, and maintaining overall health can reduce risk. Treatments, from chemo to cutting edge for decades, chemotherapy was the frontline treatment, harsh, exhausting, but often effective. Today, options have expanded: targeted therapy, drugs that attack specific genetic mutations, immunotherapy, treatments like CAR T-cell therapy, where a patient's own immune cells are re-engineered to fight cancer. Stem cell transplants, replacing diseased bone marrow with healthy donor cells. Radiation therapy, in select cases, to shrink tumors in lymphomas. These treatments come with side effects: nausea, hair loss, infections, long recovery, but survival rates are improving. Childhood acute lymphoblastic leukemia, once nearly always fatal, now has survival rates above 90% in developed countries. Prevention and early action. While not all blood cancers can be prevented, we can act to reduce risks and catch them early. Quit smoking reduces leukemia risk significantly. Protect yourself at work. If you work with chemicals, always use safety gear, limit radiation exposure, only undergo scans when necessary. Stay alert to symptoms. Don't dismiss prolonged fatigue, bruising, or frequent fevers. Get checkups. Regular blood work can reveal issues before they escalate. And remember, donate blood, platelets, and join stem cell registries. Every year, thousands of lives are saved by donors. Emotional and social impact. Surviving blood cancer is not just about medicine. It's about mental health, community, and resilience. Patients often battle isolation during treatment, guilt over depending on others, and anxiety about relapse. Support groups, counseling, and simply having someone to sit beside you in the hospital can make all the difference. Survivors often say the hardest battles weren't the needles or the nausea, but the loneliness. Call to action: Camille's survival, Tasha's resilience, Jeff's decade of remission, Crystal's 2 victories. These stories remind us blood cancer is devastating, but it is not unbeatable. This September, during Blood Cancer Awareness Month, we honor patients, survivors, caregivers, and those we've lost. But most importantly, we spread knowledge, because awareness saves lives. So here's the call to action: know the symptoms, don't delay medical care, support research and charities, donate blood and stem cells, and be there for anyone fighting the fight, because nobody should battle blood cancer alone.